Patient education. Where do we start and what do we focus on? If you haven't seen the first video on patient education, take a quick look at that. In that video, we talk briefly about what best practice patient education looks like and how we can use some of these principles to guide where our priorities are for our patient education. Now, patient education is a really tough subject. Let's firstly acknowledge that it's not an easy one. We probably have a million thoughts running around in our mind about what to cover or talk about with the patient in front of us. In this video now, we're going to look at what patient education might look like on day one, using the best practice principles we looked at in the last video. So let's look at what might be important on day one. Firstly, we must always address the patient's concerns. This is what they are wanting to find out about, and it might be the main reason they've come to see us. So this should always be a focus. If it's a big concern or a complex concern, for example, they're wanting to know why they have persistent pain, it's probably unrealistic to provide all of this information in an effective way on day one. But we can definitely acknowledge that this is a concern for the patient, let them know that we can certainly start to address this, and at the least, ensure that the patient is starting to understand key concepts by the end of the consultation. After addressing the patient's concerns, we may prioritise the following things. So this might depend on the patient's existing knowledge and understanding. But if we look at the research on what's important to patients with low back pain, we do have some insight. We may, and probably should, effectively explain the patient's condition in a way they understand that is evidence-based without causing unnecessary alarm. This might be as simple as reinforcing what another health professional has told them recently, or through making a start in understanding persistent complex pain. Regardless, giving information regarding their condition is really important. If you're struggling with how to explain things like non-specific low back pain or radiculopathy, you'll find these in the other videos. If, however, the patient has a serious condition that needs to be managed urgently, then of course raising these concerns is important. Now, the following items are important. So these are things you should consider on day one, pending your time and other priorities. Giving prognostic information to the patient. This one's not easy, but we don't usually need to give exact number of days or weeks to recovery, especially for more long-standing conditions where there has been really no specific injury. So it might be as simple as letting the patient know what to expect. How soon do you expect their symptoms to settle? How long until you think they may be reaching some of their shorter-term goals? Letting the patient know what to expect is really important. Outlining the management plan and the patient's role in the management plan is another priority. This might be brief, but again, it lets the patient know what to expect. We might then focus on some simple skills or tools for the patient to self-manage their condition, especially where pain is a limiting factor. If someone is struggling to return to work or other important social commitments, then move this one right up near the top of the priority list, as we know this is critical for recovery. And lastly, we're just going to use a few key concepts at any one time. The patient should be leaving with just a few key messages that they can recall and relay simply and effectively. So that's day one. We can always build our education over a number of consultations if needed, so we're just prioritising what the patient wants and needs to know in our first consultation.